Yes.
Welcome back to Dr. Anna's Physio. So let's continue where we stopped last time. So in the last class we spoke about the circulatory system, the basics, the anatomy. Now let's move on to the cardiac cycle. So what is a cardiac cycle? A cardiac cycle is the mechanical and electrical events that take place from one heartbeat to the next. So say if an average heart rate is about 75 per minute, the duration of one cardiac cycle is going to be 0.8 seconds. So various mechanical and electrical events take place in the heart from one heartbeat to the next. So we're going to talk about those. So imagine, like we had learned about the heart, the structure of the heart in the last class, and it has 4 chambers: the right atrium, the left atrium, the right ventricle, and the left ventricle. As mentioned in the last class, the deoxygenated blood from all the veins, from different parts of the body via the veins, enter the right atrium, right? Through the superior and vena cava. This return of deoxygenated blood via the veins is known as venous return. So, at this stage, now that you are, before talking about venous return in detail, I would like to mention, you all know that the heart, it has cardiac muscle, the heart contracts and relaxes. But in cardiology, instead of calling atrial contraction or atrial relaxation, we use the word systole for contraction and diastole for relaxation. So it's going to be atrial relaxation is atrial diastole, atrial contraction is going to be atrial systole. So now when the blood, deoxygenated blood or the oxygenated blood from the lungs return to the left atrium. So whenever the blood returns from or enters the atria, the valve mentioned here in the last class, the atrioventricular valves, the tricuspid in the right and the bicuspid in the left, they are also open. So what happens? Blood enters the atrium and passively it enters the ventricle because the valve between the atria and the ventricle at that stage is open. Okay? So it is, the atria is in diastole. So atria is in a relaxed state, like a empty pot receiving blood. And since the valve is open, about 70% of the blood passively reaches the ventricles. Now, after this, we all know the pacemaker of the heart, about which I'll be talking in detail in the next class. We have the SA node, which will generate electrical impulses. So the SA node will generate electrical impulse, which will cause the atria to contract or atrial systole. So I mentioned 70% of the blood passively reached the ventricles, and the remaining 30% that was in the atria, because of atrial contraction or atrial systole, it is pushed into the ventricle. Now, how does the valve open and close? I mean, what is the scientific reason behind it? Now, when all the blood has entered the ventricle and the atrium is empty, the pressure in the atrium becomes less than that of the ventricle. And so, this valve will now close. It leads to the closure of the atrioventricular valve. The closure of the atrioventricular valve is responsible for the first heart sound or the lub. Now, at this stage, the atrioventricular valve is closed. The semilunar valves, that is the valve between the right ventricle and the pulmonary trunk, and the valve between the left ventricle and the aorta, the pulmonary and the aortic valve, also known as the semilunar valves, are also closed. So at this stage, you have blood inside the ventricles, but both the, the entry or exit, the valves are closed. So it's a closed chamber. By then, the impulses from the SA node, which had caused atrial systole, would have now arrived at the ventricles, causing the ventricles to contract or ventricular systole. But you imagine there is blood inside a closed chamber and the chamber is contracting or in systole. So this stage is called isovolumetric contraction. As it's isovolumetric means there is no change in the volume of blood because both the valves are closed. Similarly, there is no change in the length. Okay, so it is isovolumetric contraction. Now what happens? Imagine a closed chamber contracting. The pressure inside the ventricles increases, and when the pressure inside the ventricle becomes more than that of the pulmonary and the aortic pressure, this valve will open. So when some high pressure, like you have closed a hosepipe with your thumb, and the moment you release it, there is a gush of water release. Just like that, because it was in a high pressure state, just as the aortic and pulmonary valves open, you have the rapid ejection phase. That is, about 2/3 of the blood is ejected at this phase. And then after 2/3 have been ejected, the flow of water slows down. So it becomes reduced ejection phase, where the remaining blood is ejected out. So we had atrial diastole, we had atrial systole, isovolumetric contraction, which is ventricular systole, and then you had rapid ejection, reduced ejection. Now what happens to the pressure when all the blood, or most of the blood, not all, most of the blood have left the ventricles and have passed through the pulmonary trunk and the aorta? So the pressure inside the ventricle starts to drop. Now when the pressure in the ventricle stops to drop and becomes lower than the pressure in the pulmonary trunk and the aorta, this valve will close again. Now this time, instead of isovolumetric contraction, it is isovolumetric relaxation. That is, both the chambers are closed and now the ventricles are relaxing or going into diastole. So this stage is known as isovolumetric relaxation. Now in a closed chamber, the blood volume is less and the walls are expanding, so the pressure drops. And when the pressure drops to more than that of the atria, again the atrioventricular valves open and the cycle continues. So there are a few terms and the duration which I will talk in detail. So firstly, what is cardiac cycle? Cardiac cycle is the mechanical and electrical events that take place from one heartbeat to the other. For an average person for an average heart rate of 75 per minute, the normal cardiac cycle duration is 0.8 seconds. Mechanical events include pressure changes, valve closure, opening, all the mechanical changes. Okay, and electrical is the impulse traveling. Now, like I had mentioned, during cardiac cycle you have both atrial systole, atrial diastole, ventricular systole, ventricular diastole. So out of 0.8 seconds, 0.7 seconds of atrial diastole and 0.1 second of atrial systole, when the remaining blood is also ejected into the ventricle, and 0.3 seconds of ventricular systole and 0.5 seconds of ventricular diastole. So this is basically a division of systole and diastole in the atria and the ventricles, and the sum is 0.8 seconds. Thank you. That's all for now.